Renuka is the most active and playful child in her playgroup. For her mother, she is the apple of her eye. However, Renuka was not like this a few months ago. She used to be tired all the time, even with a little playing. She wasn't growing like other children of her age and had chest infection frequently. Her parents took her to doctor, who found no significant findings except for murmurs on auscultation. So, he advised certain blood tests, X-ray and ECG, and referred her to a cardiologist. On cardiac echo, Renuka was found to have a hole in the heart. This hole was called an atrial septal defect, which had a diameter of 20 millimeters. Renuka was referred to Dr. C Raghu at Aster Prime Hospital, which specializes in the treatment of all congenital heart diseases. Renuka was thoroughly assessed and was suggested transcatheter device closure for treating ASD. Atrial septal defects are congenital abnormalities characterized by a structural deficiency of the atrial septum. This allows blood from the left atrium to pass directly to the right atrium. It accounts for about 10% of all congenital cardiac diseases. ASD is classified into 3 types: secundum, primum, sinus venosus. Renuka was recommended transesophageal echo as it helps to identify location of the defect, the size, number of holes and surrounding margins for the hole. Atrial septal defect can be closed either by a surgical intervention or a minimally invasive transcatheter device closure. ASD device closure is done using the Aster septal occluder device. This device is inserted through the groin percutaneously and is inserted till it reaches the defect. Next, the device is folded and inserted into the catheter and threaded till it reaches the defect. The catheter is passed through the defect. The disc of the device is opened and pulled against the septum, positioning it on the defect and closing it. Finally, the catheter is then removed. Renuka had an uneventful recovery after the surgery. She is now hale and hearty. She now plays with her friends without getting tired. She had even caught up with her growth and is almost as tall as everyone else. Dr. C Raghu at Aster Prime Hospital is the best choice for getting your heart diseases treated. Our cardiologists have expertise in ASD device closure. We have a highly competent team of doctors and a well-trained staff who have extensive experience in managing ASDs. Aster Prime has one of the best cath labs that are available 24/7 for primary angioplasties. Be a part of such stories. If you feel that your patient requires cardiac interventions, refer them to us. The patients can reach us by calling us directly or through our website. If you need an instant opinion about your patient, you can reach us out through WhatsApp or Viber as well.